This video will cover the steps on how to properly document on the interdisciplinary plans of care in OneChart. For this video, we will be looking at a patient who is an 86-year-old female that had been admitted with pneumonia, complaint of inspiratory chest pain, rating it 10 out of 10, a productive cough, and a temperature of 38.5. Normally at home, she can ambulate without assistance and is alert and oriented ×4. Her daughter stated she has been in bed for over a week with flu-like symptoms, decreased oral intake, seems confused, and needs help to ambulate. Her fall risk score is an 8 and a Braden score of 15. She was noted to have a red coccyx. Past medical history includes end-stage renal disease, for which she receives dialysis on Mondays, Wednesdays, and Fridays. What IPOCs do we need? Let's start by reviewing our suggested IPOCs. They are suggested based on your nursing assessment. Choose IPOCs that will tell the patient's story, which should be meaningful, involve the patient, and, if possible, their family or other caregivers. When picking IPOCs, it may help to go over the following questions. 1. What is the patient's admitting diagnosis? What is their past medical history? 2. Is the patient at risk or have an assessed issue related to a fall risk, risk for skin breakdown, an MST or PNST score of greater than 2, an MDRO, pain, risk for VTE, restraints, or a learning barrier? 3. Is PT, OT, ST, RT, or a registered dietitian seeing the patient, and what interventions are being done? 4. Has there been any significant diagnostic tests resulted that should be reflected in the IPOC? We will initiate the fluid volume imbalance, fall prevention and management, ineffective airway clearance, and pressure ulcer prevention IPOCs. To do this, simply click on the name of the IPOC and then select Accept. Afterwards, you will need to customize these IPOCs. After accepting the IPOC, check all goals, indicators, and interventions that make sense for the patient and this phase of their hospitalization. The goals are the bullseye icon. This is what the patient should accomplish. Goals should be meaningful and attainable, and they need to be measurable with a target date. The date displayed is a suggestion target date. If more time is needed, right-click and increase the time frame. When charting, chart this as either met or not met. Indicators are the graph icon. Indicators show the progression towards the goal. This is your as evidenced by. Indicators are updated via flowsheet documentation, and some will write back to the IPOC. Interventions are what is actually being done for the patient. Choose all that apply. These are usually charted as done or not done. Select the goal for maintain fluid volume at a functional level. The goal is set to be completed within 3 days. However, your patient could potentially be here for 4 days. Right-click to modify this date and update it to 4 days. Indicators that will be assessed include monitoring of lung sounds left and right and measuring their weight. We want to include the dialysis plan of care. Right-click on the patient-specific intervention, select to modify, and remove the text. Then add dialysis Monday, Wednesday, and Friday. Next, we will accept the fall prevention and management IPOC. Uncheck the goals for verbalizes understanding of fall risk precautions and takes action to control fall-related risks, as these goals are not appropriate for our patient's condition at this time. Next, you will need to accept the ineffective airway clearance IPOC. Check the goals and change the goal dates to 4 days. Check the interventions that you will need to do for your patient. Next, we will add a patient-specific goal. To do this, we will add to phase and then select Add Outcome and Intervention. In the search field, type in Family and select the goal for Family Understands Plan of Care. Select OK to close the window. Accept the first phase for pressure ulcer prevention and include a patient-specific goal of return to baseline for ambulation. Select Order for Signature for all IPOCs selected. Documentation of IPOCs should be done once per shift. Let's do a quick review before we document. First, review the target completion date and time for each goal. If more time is anticipated to be needed, change the date to allow for that. Note, if the target date is in the past, you will not be able to document the evaluation date and time for the current date. To start documenting, select the arrows in the status column. Our first goal is not met. The outcome variance reasons do not apply, so you will need to free text into the box the rationale, as the breath sounds are coarse. The next goal is also not met, that the patient's cough is non-productive. Again, the indicators will pull from your flowsheet documentation. We can see this by using the plus sign in front of the indicator to view the prior documentation. To chart the interventions that were done, we will use the arrows to document. Finish charting on the rest of the IPOCs. The next IPOC is also not met, as they are still unable to ambulate without assistance. The next goal is also not met, as the patient still has poor oral intake. Since we try to include the patient and their family or other caregivers, we will chart that we discuss the plan of care with the patient's daughter. To complete charting, sign your documentation. As the patient's condition changes, so should their IPOCs. Our patient's condition has changed. She is now alert and oriented ×4. Physical therapy has seen the patient as well as a registered dietitian and has made recommendations. To make changes on an IPOC, select the IPOC in the order screen. If the IPOC needs to be discontinued, simply right-click on the name and select Discontinue from the menu options. If you need to expand any of the hidden components within an IPOC, select the light bulb option. To update the IPOC to reflect the patient's changing condition, check the goal for participated in techniques to maintain a patent airway. Right-click and discontinue the first two goals as these are no longer needed. In the Document and Plan tab, the discontinued goals and IPOCs will still show. To filter these off, you must change the filter at the bottom. To do this, select the Show Additional Outcomes button at the bottom. This filter is set to show all active and inactive outcomes. Change to 1 minute so that this will only show all outcomes for the past minute. After the minute has passed, any discontinued or completed goals will be filtered off. You may need to change this filter back to show all outcomes if the target date for the goals is in the past. This completes the video on how to document a patient's IPOC. As a reminder, you may refer to this training video at any time by using the Nursing OneChart space on the source, through My Learning, or by referring to the job aids available through Learning Live.